The Osteology Consensus Conference is an exciting and very effective tool in order to collect data from science combined with the expertise of world-leading experts in the field of regenerative dentistry, and to condense all this information together into clinical recommendations. And what makes this so interesting and so applicable is that these clinical recommendations, they are really instruments which help us to improve our daily practice in our clinics and to make patient treatment better. In a group we have assessed here, we have looked at the aesthetic parameters of the peri-implant tissues, and we have focused on whether we can give recommendations in terms of distances between the bone level and the prosthetic contact point in order to predict the papilla fill of single-tooth implants, and to give also recommendations in terms of how far apart implants have to be in order to have a better prediction in order to fill the inter-implant distance with soft tissue. So I think we'll end up by having really exciting new informations which will influence our daily practice.